Dear colleagues, welcome to this Hematology Round Up for ASCO 2024. We have focused on hematologic malignancies with 3 abstracts which were presented on June 2nd, 2024. The first presentation was the phase 3 study results of isatuximab, bortezomib, lenalidomide, and dexamethasone, Isa-VRd, versus VRd for transplant-ineligible patients with newly diagnosed multiple myeloma. Presented by Dr. Facone, this trial presentation came with a concomitant publication out in the New England Journal of Medicine. This international phase 3 trial evaluated the efficacy of adding the anti-CD38 monoclonal antibody isatuximab to the standard VRd regimen, bortezomib, lenalidomide, and dexamethasone, for newly diagnosed multiple myeloma patients ineligible for transplantation. The study enrolled a total of 446 patients, randomized to a 3:2 ratio to receive either isatuximab VRd or VRd alone. At median follow-up of 59.7 months, the isatuximab VRd group demonstrated significantly improved progression-free survival compared to the VRd group, with estimated rates at 60 months of 63.2% versus 45.2%, with hazard ratios for disease progression or death of 0.6. It was seen that the addition of isatuximab increased the percentage of patients achieving complete response or better, and significantly enhanced the rate of minimal residual disease negativity in those with a complete response. The safety profile of isatuximab VRd was comparable to VRd alone, with no new safety signals observed. The incidence of serious adverse events and those leading to treatment discontinuation were similar between the two groups. These findings suggest that isatuximab VRd represents a more effective initial therapy option for patients aged 18 to 80 with newly diagnosed multiple myeloma who are ineligible for transplantation, potentially setting a new standard of care in this patient population. The second presentation was a phase 3 randomized benefit study of isatuximab plus lenalidomide and dexamethasone with bortezomib versus Isa-VRd in patients with newly diagnosed transplant-ineligible multiple myeloma, presented by Dr. Ledoux. This trial presentation came with a concomitant publication out on Nature Medicine. In the benefit study, the efficacy of combining isatuximab with lenalidomide and dexamethasone, Isa-VRd, versus adding weekly bortezomib to the regimen, Isa-VRd, in transplant-ineligible patients aged 65 to 79 years with newly diagnosed multiple myeloma was evaluated. The primary endpoint was minimal residual disease negativity rate at 10 to the negative 5 by next-generation sequencing at 18 months from randomization. At this endpoint, Isa-VRd significantly increased the MRD negativity rate to 53% compared to 26% in the Isa-VRd arm. This benefit was observed as early as 12 months and was consistent across various subgroups, including those with high-risk cytogenetics or stage 3 disease. Secondary endpoints also favored Isa-VRd with higher rates of complete response or better, 58% versus 33%, and a faster time to achieving response compared to Isa-VRd. Despite these MRD and response rate improvement, survival data remained immature with median follow-up of 23.5 months. The 24-month estimated progression-free survival and overall survival rates were promising for both arms, with Isa-VRd showing slightly higher PFS and a similar OS compared to Isa-VRd. The safety profile of Isa-VRd was manageable, with expected adverse events such as neutropenia, diarrhea, and infections, though peripheral neuropathy rates were higher with weekly bortezomib. In conclusion, the benefit study supports Isa-VRd as a new standard of care for transplant-ineligible NDMM patients aged 65 to 79 years, offering significant improvements in MRD negativity and response rates over the current triplet-based regimens of isatuximab with RD. Further studies are needed to assess the long-term survival benefits and optimal dosing schedules for bortezomib in this regimen. The final presentation was a PERSEUS trial with Daratumumab, bortezomib, lenalidomide, dexamethasone, or VRd, in transplant-eligible patients with newly diagnosed multiple myeloma, or NDMM, analyzing minimal residual disease. The primary analysis of the phase 3 PERSEUS study has unveiled a significant advancement in the treatment landscape for transplant-eligible newly diagnosed multiple myeloma patients. Subcutaneous daratumumab combined with bortezomib, lenalidomide, and dexamethasone, or DVRd induction consolidation, followed by Daratumumab R maintenance, demonstrated superior progression-free survival and increased depth of response compared to VRd induction consolidation, followed by lenalidomide maintenance VRDR. In this study, further analysis revealed that responses deepened over time with DVRd, with higher rates of achieving complete response or better and minimal residual disease negativity. Importantly, MRD negativity rates increased over time with DVRd, particularly at 12, 24, and 36 months after treatment initiation, demonstrating sustained benefit. A greater proportion of patients achieving MRD negativity during maintenance with DR experienced improved PFS, emphasizing the clinical significance of this treatment approach in improving outcomes for transplant-eligible NDMM patients. In the context of maintenance therapy, the benefits of DR over lenalidomide alone were pronounced, with higher rates of deep and sustained MRD negativity translating into meaningful improvements in PFS. These findings underscore the efficacy and durability of the DVRd and DR maintenance regimen, advocating for its adoption as a new standard of care for transplant-eligible NDMM patients. In the discussion, Dr. Langren discussed how quadruple therapies showed higher rates of minimal residual disease and longer progression-free survival compared to triplets, regardless of age and transplant eligibility, potentially making them as a new standard of care for newly diagnosed multiple myeloma. He emphasized the importance of minimal residual disease as an endpoint in newly diagnosed multiple myeloma, suggesting that having as an early endpoint for accelerated approval could give patients faster access to new therapies. However, he also highlighted that bortezomib increases the rate of peripheral neuropathy. Dr. Langren pointed out that CD38 monoclonal antibodies narrow the gap between transplant-eligible or younger and fitter patients and transplant-ineligible, older and less fit patients with multiple myeloma. Thank you for your attention, and I hope you enjoyed this first Hematology Roundup here at ASCO 24.